All right, hi everyone. We're here with Dr. Katia. She's going to just briefly explain where she's from, what's her background. We're going to be talking anything to do with perimenopause and menopause. The reason I'm doing this is I have a lot of clients that are in that stage of life and they are very confused. They don't know where to go, they don't know what exercise to do, and they don't know where to turn. So I've got Dr. Katia's expert advice that she's going to walk through some of the questions that some of the ladies that I have put together that want to know. So hopefully this is helpful for anybody out there that is just confused in the space. So I'm going to hand it over to Dr. Katia and she's going to explain a little bit about her background and where she's come from.
Okay, so I work as a GP in Brazil for the last 2 years. I'm from Brazil. I did my medical degree in Bolivia and after in Brazil and now in Australia, which means that I did medicine in Spanish, Portuguese and non-English. So I'm a GP who works with women's health. That's one of my favorite ones because I myself went to menopause at the age of 32. So I really got deep to understand what happens to your body, what is the best things to do when you're going through perimenopause and menopause.
Okay. So I guess the first question is, what is perimenopause and menopause and how do women know when they are in it?
So usually we call, to understand better, menopause means that you do not have a period for a period of 1 year, 12 months. So your ovaries shut down, they're not working anymore, no more period. So menopause is just a name for 1 year without your period. Before this menopause, you have something that is called perimenopause, and perimenopause can last 5 to 10 years before getting to menopause, which means that your hormones has a lot of changes. Your ovaries will be overreactive or underreactive, which means that sometimes your ovaries will produce normal estrogen and progesterone. I'll get later on explain the female hormones. And sometimes your ovaries will not produce estrogen and progesterone, and sometimes you produce a bit too much. So the most common symptoms, I'll say, people complain about hot flashes, night sweats, and mood swings. Those are the three that are actually one of the latest symptoms because it's more like perimenopause and menopause. But the symptoms can vary from brain fogness or just memory problems, joint aches and pains, and sometimes irregular periods. We can be lighter, heavier, shorter or longer. So it's a lot of symptoms. So especially the mood. So a lot of people get more angry, they cry easier, so more depressed, more fatigue, and of course the pain, aches and pains, and the brain fog.
Okay, so I've got a couple of questions here that some of my clients have shooted through. Why does my body feel like it's changing even though I'm training and eating the same as I always have?
So this is again due to do with the hormone, female hormones, especially the one that we call the most female hormone, that's estrogen. So the estrogen is responsible in a certain way to help you to build lean muscle and the distribution of the fat. So sometimes when the estrogen has these peaks up and down, it will have much harder for you to put on lean mass, and because you don't have enough estrogen, you increase your body fat. That's nothing that you're doing wrong. It's just hormonal change that all of the female goes through. So in the estrogen, in a certain way, he becomes testosterone, and testosterone in a low dose for females is really important for the lean muscle, the bone mass, and also for the libido. So it's your ovaries, it's hormonal change, it's nothing that you're doing wrong. It's not the exercise, not the diet, the hormones.
Yeah. Why does my belly fat seem to appear during perimenopause and why is it so hard to lose?
Yeah, like I explained before, so it's related to the hormonal changes. It's nothing wrong that you're doing wrong. So the estrogen usually, because he puts on lean mass, so if you have low estrogen, you increase the body fat. And usually as a female, the deposition of the fat is survival, say so, is more abdomen, tight, and actually in the back. So this is the estrogen. However, the reposition of estrogen will not get what you want. Actually, it's exercise and
Yeah. So you're saying people that get the belly fat down here, there's really nothing you can do apart from doing your best to exercise, eat better, more protein. What's your stance on protein? Carbohydrates, fats. There's a bit of confusion in that space as well. Everyone says eat protein, but why? Can you explain why?
Yeah, so actually, remember that how do you build muscle? How do you build lean muscle is through protein, through amino acids. That's the breakdown of the protein. So the carbohydrates, actually, we are not, I'm like a paleo carnivore person. So I don't, low carb diet. So the carbs actually doesn't make you build up muscle. What make you build up muscle is lean protein and actually amino acids. So I usually say 1.6 gram per kilogram of protein daily if you're not doing like a strength weight training. If you're doing it, you need to increase at least up to 2.2 grams of kilogram of protein daily. So nothing against the carbs. So I think that in life it needs to be 8-20% rule. 8% of the time do what is right and 20% enjoy the chocolate, the pizza, the pasta. So it's really important because protein is the base of the lean muscle. So the belly fat again, so the estrogen is the one who helps you to build up the lean muscle. If it's low, of course your body will understand that you need to put more fat around the waist. So, and to lose this fat around the waist, it is weight loss, exercise, and in some cases, of course, you can have hormonal replacement therapy on the advice of a doctor.
Another question would be, how many times ideally would a woman need to weight train in a week? Like, what would your stance on this be? 2 to 3 times a week, 5 days a week? Obviously their body's going through a lot of changes, and exercise does help with a lot of things. You just mentioned mood. I guess it's a sense of a community as well. How many times a week would you say for a female to exercise weight training?
So exercise helps a lot, like you explained, lean muscle. We don't talk about the mood, but the best treatment for any type of mood disorder, anxiety, depression, low mood swings, it is exercise. So, and 2 or 3 times a week with weightlifting training, but remember that when you're going through all of these hormonal changes, you need to have the rest days. That no one wants to do it, but you need rest days, so to recover, because your body is going through hormonal changes. You're not 20, 13 years old. You have different life fluctuation with estrogen and progesterone. Because of the fatigue, that's also a symptom of perimenopause and menopause. That's important to rest. I'll say ideally 3 times a week, but if it's not possible, at least 2 twice a week.
Yeah, I'm going to pipe up on this one. So, as mentioned, 2 to 3 times of weight training. A lot of people, and I actually spoke about this today to a few people. There's a lot of people out there that go and do 5 days a week, 6 days a week, and they go do a class, and they train at a medium size, I guess, training level, and they're just plodding along in that particular space. To make physiological changes to your body, you do need to train in a higher intensity bracket. That's not to say I want you to do that 5 days a week, but 2 to 3 times a week in that space. And then we need, as was mentioned, our recovery days. And that doesn't need to be do nothing. That could be go for a walk, go for a swim, and it could be Pilates. Don't hate me, all the Pilates people out there, but that is not strength training. That is it's a stretch, it's a recovery, it's your recovery day, I would class that as. And as mentioned, it is so important to do those recovery days because we aren't 20, we aren't 30, we can't bounce around. I don't know about you, but I used to go play netball, tennis, basketball all in one day, wake up the next day, I can do it again. I cannot do that now. I am so sore and I need the recovery. So as we age, we need to train in that higher level and we need to train in that lower level. Hopefully that makes a little bit of sense for the people that are out there. So somebody else has mentioned, why do I feel more tired, sore, or slower to recover after workouts than I used to? I think I kind of just mentioned that, but I'll just get Dr. Katia's take on that.
Again, I'll explain. So we're going through hormonal changes. So one of the symptoms of perimenopause and menopause is that we call like fatigue, tiredness. So your recovery is a bit slower because your metabolism is low because of the estrogen and the testosterone. So yes, we will feel more sore, more fatigued. So that's important, the rest days. As mentioned before, rest day does not mean lie down in bed. So I really love yoga. I believe that a walk is really good. Swimming is like a stretch and balance exercise. So rest days does not mean doing nothing, but you need to at least rest a bit. So it's female hormonal changes again. So that's why of the fatigue, the recovery.
Yep. Someone else mentioned, can exercise help with mood swings, anxiety, low motivation, and brain fog? I get that a lot. I have brain fog. It was kind of mentioned before about exercise. Exercise helps in dopamine levels, which obviously makes you feel a lot better about yourself. So is there anything else that you would suggest people do when they do have brain fog? Because that is the biggest thing that I think a lot of the females that come into here is they like brain fog. And I know one lady, and if you're watching, she knows who she is. It just gets so lost in here. She has no idea what she's doing. I have to like constantly be like, you're over here, you're over here. And she just tells me, oh, I've got brain fog. I can't even concentrate for 2 seconds. Is that normal for one? And what can we do about that?
Okay, so brain fog is one of the most common symptoms of perimenopause and menopause. And actually, yes, it's related to the hormonal changes, but there is related to something that lack of sleep. So when the person comes to talk to me about brain fog, then my first question, how is your sleep? Because usually the person has like broken sleep, wake up at 3 a.m., cannot fall asleep again, and actually they sleep like really good sleep, will be 3 or 4 hours. That's not a restful sleep. So brain fog is related to sleep too, and they sleep again. If you're having like broken sleep, if you're like having night sweats, hot flashes, waking up at 3 a.m., it means that your hormones are not in a good level. Sleep is progesterone, so that's when you need to talk about maybe. So after blood test, a consultation with your GP about like a hormonal replacement therapy with severe symptoms. So brain fog sometimes can get better with like a really good indication and ruling out all of the contraindication for hormonal replacement therapy and improving the sleep and managing the stress. We go for meditation and yoga. That's a really good that help a lot brain fog.
Okay, so brain fog is really related to sleep, so lack of sleep.
And also the hormonal changes.
Yeah, okay. So I have a lot of females that don't get much sleep at all. They do wake up a lot. Let's talk about HRT. Okay. When would a female go, I've had enough, I want to do something about this? I want you to talk about when they're at breaking point, because let's be honest, there's a lot of females out there that they are just in breaking point. 1, where should they go? 2, what's the process? 3, what's the symptoms? What's the benefits? Talk to me all about it.
Okay, so HRT actually is, there's not a time. I can have patient with 32 will be an HRT if they go for early menopause. I can have patient with 38 will be with like a hormonal replacement therapy. And I have patient with 70 on hormonal replacement therapy. There's not any specific date. It's about your symptoms, what exactly are you feeling. So if you have severe symptoms, brain fogness, you're not sleeping, you have a lot of mood swings, you have night sweats, hot flashes. So I usually do like a blood test to make sure that you don't have too much, and according to these results, because it's a screenshot, we do like a questionnaire about your symptoms, we'll decide if it is a best like trial to see if you respond to estrogen and progesterone. And before starting the medication, we need to rule out some contraindications. So one of them, the biggest one, is breast cancer. So if you had breast cancer before, you are not exactly a good candidate for these medications. If you have a strong family history of breast cancer, you need to know which age. And all the time I ask my patients to do like something that we call mammogram. If they're over 40, and if they're younger than 40, at least an ultrasound to make sure that they're not missing anything. So we need to rule out breast cancer. So of course there are other contraindications like something like stroke that no one talks about. If you're a heavy smoker, you have a really contraindication. If you have any heart problem like a heart attack, or if you have like a bypass, a stent, or all of these things is also contraindication for HRT. So everything that can burden your arteries, I'll say so, that means stroke, heart, we are not allowed to prescribe HRT as a GP, but I can send for a gynecologist that will like do a better approach and decide which one and how to prescribe this one. So HRT is not age, it's about symptoms. So it depends on your symptoms. We do a blood test, but if you have severe symptoms, we do a trial with the medication to see if you respond. But the basic of the management of perimenopause and menopause is still lifestyle and exercise. So we have the other ones, medication that's non-hormonal ones that you can try. So it's not HRT, it's hormonal replacement therapy that you change the name for menopause replacement therapy. So just like because you need these hormones for life. Estrogen is a good guy.
So can you explain that a little bit? Because I don't know, I have no idea about that. That makes to me. So there's HRT, that's separate to hormonal.
It's the same.
It's the same.
It's just change the names.
Okay.
It's the same thing.
Okay.
Hormonal replacement therapy.
Okay.
Because we are just trying to change the name replacement because you're not replacing anything. Because all of the female needs like estrogen and progesterone. Small comparison. Guys have testosterone up to late in life. They don't have a drop like females. So female, as soon as you reach 45 to 50, you just have a big, massive drop in your hormones, estrogen and progesterone. And females are living up to 90. So, and you need these hormones for your lean muscle, for your bone health, and it's proven that actually helps with cognition, prevention of Alzheimer. It's like, yes, so that's why. Yeah. It's not replacement. It's just like we need the medication.
We need it. Okay. So that's it. Guys, anyone that's on the live chat, if you have any questions that you would like to get answered, pop it in and I can relay that back. So any questions, those that are listening in that you have that you would like to know, now is the time. Another question I do have, I think there's a couple of people, and I'm very similar. I don't like taking anything. I don't even like taking a Panadol. Like, I'm not joking. I just don't like taking anything in my body. Is it harmful? Like, is there side effects? Is it harmful? Or is it quite safe for someone like me that actually doesn't like to take anything? Is it safe? Or am I better off doing diet and exercise and hoping for the best? Like, what's your take on that?
If you're in perimenopause and you still have like estrogen and progesterone in your body, and if you can manage all of the symptoms with lifestyle, I'll say like exercise and diet, I believe that you do not need the replacement therapy because you're still producing estrogen or you're still producing progesterone. You can check time to time to see how low are they. But when you go to menopause, it means you're overshot down, you don't have any estrogen and progesterone. That's when I think it's really advisable to have the estrogen and the progesterone because you do not have them anymore. And what we have today is just like they call biosimilar. The most similar to our female hormones is not the same estrogen from 50 years ago. So it's something really similar to the same one that you produce. So it will not cause harm, actually have a lot of benefits. Because can you imagine if you're 50 and you don't have anything else? So your body will not produce estrogen and progesterone for any other source because it's gone. So that's why you need this medication. So, but again, the base of the treatment is lifestyle. But as I think menopause is really important to have estrogen and progesterone for lean muscle, bone health, and protection from osteoporosis and osteopenia. You do not produce estrogen.
Yeah, okay, all right. Key takeaways from this. Like, I'm assuming it's lifestyle, which you've said. Good weight resistance training, good diet, protein. If you need to, then you're going on a hormone replacement. That's kind of the process I would say you're going to be doing. I don't think a lot of people, let's talk about this for a second. I don't think a lot of people realize that don't quote me on this, you can tell me if I'm wrong or not. Estrogen drops a lot once you get over a certain age, which you need and is very important for your bone health.
Yeah.
So I think a lot of females, especially when we get older, our bone mass deteriorates, and you see a lot of people when they're older breaking their hips, falling over, hurting themselves a lot. That has a lot to do with that estrogen drop. Yeah. So would you say that going on a hormone replacement would help to prevent that along with exercise? What's your take on that?
So actually, because we don't talk about bone health, we never talk about female health. I think just maybe 10 years from now that people is talking about this kind of thing. So now we need to understand that without estrogen, so we actually will not have like not exactly lean mass, but it's the bone health that no one talks about. And the bone needs estrogen, and the bone needs vitamin D and calcium in their diet. So, and the only way that the bone can build up is if you lift weight, because the bone likes to be like in a challenge. So the bone without weight lift, it does not produce bone mass because he understands that he's not being in a challenge. So when you look about calcium intake for the bones, it will drop massively after 35. So that's really important to have like a really good calcium intake diet. Vitamin D, that's the sun exposure. Victoria, I usually advise everyone to check because you don't go to the sun enough. We need to take vitamin D. And weight lift because the bone needs the challenge. And estrogen, because the estrogen is the responsible, the female for the bone health. Male is testosterone, like I explained before. So estrogen drops really quick when you're 50, when you go to menopause. Menopause, no period, 1 year, no estrogen. Guys, they have testosterone up to 70. So that's why guys doesn't have that much osteopenia and osteoporosis.
Yeah.
And if you keep you like a lean muscle, health, body weight, and strength and exercise, your bones will say thank you and balance.
Yeah.
Okay. So my takeaway is perimenopause lasts 5 to 10 years. So it's before menopause. The symptoms can be mild, moderate, and severe. And if it's severe symptoms, you're a good candidate for hormone therapy. So if you can manage lifestyle, exercise, and that is perfect. You don't need to go for the replacement. Yeah. Menopause, I think, is important. So I think menopause, when you reach menopause, talk to your doctor. Make sure that you are a good candidate that don't have any contraindications because we are leading up to 90. So, and we need bones after 90.
Yeah.
So
I do have quite a few clients that actually have the one before
osteopenia.
Yeah.
Osteopenia means like it's one step before the osteoporosis. So unfortunately, the guidelines say that the first bone density scan that's covered for Medicare is at age of 70, which is completely wrong. But if everyone is open to pay like private, I usually advise maybe as soon as you go to menopause or maybe 5 years later, just to make sure that the bone health is not.
Okay, that's good advice. So anybody out there that is getting into that age, we recommend a DEXA scan for bone health just to check where we're kind of sitting. Yeah. You mentioned before supplements, so let's talk really quickly about supplements that could help with perimenopause and menopause, whether that's helping with their symptoms or just helping with the prevention of what's to come in that stage. You mentioned vitamin D and calcium. Is there anything in particular that you would recommend? Like, I know there's a lot of people out there that struggle to sleep. Would magnesium be good for that? Like, is there something that you would recommend?
Yeah, I usually say sleep is training. So because no one believes that sleep is training. So that's why I train kids to sleep. So, and after when you get old, we forgot that you need to have like time. So every day at the same time. So no bright lights, cool dark room. Do not read. Do not touch your phone. So it's training. So There are supplementation that can help to sleep. Magnesium because there's like a muscle relaxation, the glycine, and melatonin in a low dose can help too.
Oh, melatonin. Okay.
Yeah.
Yep.
Actually, this is the supplementation for sleep. Something more than that, I'll say like meditation that people doesn't like to do a lot.
I personally think that's woo woo, but you highly recommend it.
Yes,
Yeah.
reading, just like writing your journal, write all of your concerns for the next day is training. So in regard to supplementation, is so many supplements outside for so many things. That's when you need to go and talk to again to your doctor. Make sure that you need the supplements because not only the supplements, it's required. Some of them can do some harm.
Yeah. So recommend a blood test. Go get a blood test so you get everything checked just to see where you're at. And where are you based? How can people reach you? Because I'm sure there are people that want to talk to you. How do we contact you? How does people get in touch with you?
I work at the Gillsville Medical Center, so it's just like the 34 Simon Street. Be free.
The main things was sleep, brain fog, how many times you should be exercising, how much exercise you should do, what type of exercise. Actually, let's quickly touch on cardio. I know it's your favorite. She hates cardio, by the way. So yes, we need to do resistance training because one, we need to build up muscle and we need to protect our bone health. I know you don't like cardio, but what are the benefits of cardio when it comes to perimenopause and menopause?
Yeah, so cardio is really good for the heart rate and for the lungs. So again, cardio is not bad if it helps with your I'll say mood. So some people when they're running, some people when they're swimming, some people when they do really intensive cardio can get really good mood, and actually manage their mood. So I'm the other side. I like yoga because I like to slow down. But this is just like cardio is you can do it, but it's not the main thing for like bone health, but for mental health and for the heart. The heart loves cardio and the lungs love cardio, so it's good for mental health and helps with the symptoms, of course.
Yeah. So anyone out there, and men specifically, let them go run if they want to run. You will have a better life. What did I say? Happy wife, happy life. So as I mentioned before, and we've both mentioned, resistance-based training, number one is your priority. If you enjoy running, if you enjoy doing your cardio-based exercises, then go and do it for your mood, to help with your mood and how you feel. But priority, priority, priority. I cannot drum it into everybody enough. You need to be lifting weights. Actually, I should rephrase from that. You don't need to lift weights. Some people don't like lifting weights, but you need to do resistance-based training. Yeah, I should stop myself from saying that because you don't actually need to lift dumbbells or a bar. And if you don't know what you're doing, that's really daunting. It could be resistance-based, and resistance is actually moving like a squat, a body weight squat. You're pushing against your own resistance. It could be push-ups on the floor. It doesn't actually resistance bands. It just needs to be something.
Resistance. Yes.
Yeah.
Challenge your bone.
Challenge bone. There you go. So if that's a body weight squat for you, or if it's a push-up off a bench for you, then that's a challenge enough. All right, we're going to wrap it up. Thank you so much for your time.
Thank you.
Yeah. All right. See you guys. See ya.